We brought in Dr. Gary Bluestone, Chief of Infectious Disease with Kaiser Permanente, to tell us more about Ebola, and it sounds pretty scary out there right now. You know, a lot of people are worried. Should we be as worried as we are?
We should be cautioned. We should not panic. The infection is certainly here. It's the first case that everybody knows about. They're referring to the patient that is currently in Dallas. But yes, we should be concerned, but we should tame the panic down a bit.
Well, it's hard. I mean, you know, because I just wanted to ask you really quickly about what kind of guidelines are you following at your hospitals? Are you following CDC guidelines as far as, you know, if Ebola was to come to Pasadena or Los Angeles area, or do you have a whole separate set of guidelines for your hospitals?
The backbone of our guidelines that we've developed at Kaiser Baldwin Park are based on CDC guidelines. They're straight out of CDC guidelines.
And you know, that's the worry, because obviously a lot of hospitals got these CDC guidelines, you know, the Texas Presbyterian did, and you know, things fell through the cracks, and that's the fear of how easy is it for things to fall through the cracks.
But obviously that's a cautionary tale case. All the systems were in place, and the patient did fall through the cracks. It's a steep learning curve. We're still, you know, trying to learn how to manage these patients, how to make sure that they properly get picked up, isolated, and ultimately diagnosed and taken out of circulation. Like I said, it's a cautionary tale, but we're learning from it. If a patient were to come to our hospital, I do have 100% confidence that we were going to be able to perform admirably and pick that case up and isolate.
Mm-hmm. Do you know if is there any screening, you know, when people come into the United States, are they filling out a questionnaire, or do you know if there's a way to sort of to stop them at the border, so to speak? We were reading about stories of a couple of people. There's people who were ill on a flight, and they weren't taken off the flights from Liberia. I'm just curious if there is some sort of screening or questionnaire that goes on.
There is a questionnaire and there is a screening. Unfortunately, human nature being as it is, not everybody is forthright, as this case that we just discussed.
Well, the hard part is, I mean, you know, there's a great likelihood, especially with a flight from Liberia, which is really long, someone could, you know, get on the plane feeling okay, and then all of a sudden mid-flight, you know, 15 hours later, not feel so good. And there's a easy way to, you know, you go to the bathroom, you know, things happen in there, and you know, there's not sanitary conditions, and then you have other people using the same small area. I mean, is that a concern for people, do you think? It
certainly is a concern. The comfort is that Ebola is not easily transmittable. It requires a contact with body fluids, blood, vomit, stool, urine, etc. Casual contact, as such as you described on a plane, for instance, would not be considered a high-risk exposure. So yes, but it's a concern. It would not be considered a high-risk exposure.
So not like,
for instance, shaking hands with a passenger, that in this hypothetical case you're presenting, shaking hands is not considered a high-risk exposure.
Now, I mean, but shaking hands with someone and then, you know, brushing your hair, or, you know, having your hands around your face, I mean, right there, that's an easy way to get it, isn't that?
Not a high-risk exposure.
Really?
So
Why is that? Tell us about
sneezing,
that.
not a...
No, it's not a respiratory virus.
Is it because you need, I mean, is there, because if you had a little bit of virus on your hand and you touched your face, is there not enough virus, or why is that a low risk?
It's considered a low risk exposure because of lack of body fluids exposure. I mean, like I said, it's something you can get from coughing, or it's not transmitted through water or fomites or touching surfaces. It really requires, like I said, a considerable body fluid exposure.
So, I mean, because I've read, like, you know, it's in saliva. Let's say if you cough, if it's, or, you know, it's in sweat, and then the saliva if you cough. So are those just too small of amounts, or?
It seems to be that that's not a preferred mode of Ebola transmission.
Okay, so it would just need to be a
Requires.
lot more. Okay, well that,
Good to know.
because yeah, for a lot of people it would seem that it's just a small amount.
Yeah, because you shook hands with a theoretical patient.
Okay.
It doesn't guarantee that you're going to get Ebola. In fact, it's a very low risk situation.
Great.
Okay.
Good to
Well,
know.
thank you for clearing some of that up. I know it's going to make a lot of people feel better. But in any case, you should wash your hands. That is a big takeaway because that really can make so much of a difference. And get your kids to wash their hands too.